Of course, it's my great pleasure to introduce Vanessa Kerry. Vanessa, I've known for a while, of course, a real leader. She's a co-founder and CEO of Seed Global Health. You already heard it mentioned earlier by Naveen Rao about a nonprofit organization that focuses on health system strengthening and will cause transformation through long-term investment, especially in training of workforce. Now, Vanessa has been in global health for quite a while, a major leader. More recently, she was appointed as the WHO Special Envoy for climate change and health and supported the UAE COP28 presidency to shape the first ever COP and Health Day. So she continued to lead many efforts globally to ensure equitable and just climate action. So please join me in welcoming Vanessa.
I want to start just by, hello, good afternoon, everyone. It's great to be here. And I want to start by congratulating and thanking that panel because I think just the representation of government, of foundations, of multilateral development banks, of private sector, not only speaks to the kind of collaborations we need in the shared thinking, but it speaks to also the fact that there's a diversity of us that are finally really embracing this intersection of climate and health, which is here, it is real, and it's the reason I am very grateful to be able to join you to speak today on this topic. And I want to thank the National Academy of Medicine for bringing forth and continuing this important, really important momentum for the climate and health nexus and agenda. Because, and I've said this many times, it was said on the panel, the climate crisis is fundamentally a health crisis. And when we think about people, all of us in this room, all of us that we serve through our various pieces of health and the work that we do in health, it is about saving lives. And the reality is, though, that climate change is killing us currently, whether we like it or not. That is the reality. And this past year, without question, should have been a wake-up call. It was the hottest year on record so far. And the reality is that we are seeing even now in 2024, we are continuing to see this. We see a drought in Southern Africa that is putting millions of lives at risk. Our oceans are at a tipping point that have ramifications around the globe. And in the past few weeks alone, we have seen flash flooding in China, Dubai, and Oman that have absolutely been apocalyptic in not only appearance, but in the lives that are being impacted. So climate change is already, we've heard this multiple times, it is already causing irreversible harm to people's lives. And it's important, as we've noted, that we see the impacts directly on human health, and you can list all the different ways: mental health, vector-borne communicable diseases, non-communicable diseases, maternal health, children's health. But I think what's critical to realize is that we are seeing it indirectly on the impacts on people's health. People are losing their economic well-being and their security. We see that on a household level, an individual level, a community level, a national and a global level. So whether it's through forced migration, where we expect to see 1.2 billion climate migrants by 2050, or through the loss of livelihoods, Tamer shared, and we also, I think Pam shared, the 130 million that are expected to go into poverty, a third of which are going to be from the impacts of climate and health. But we expect economic losses of 178 trillion over the next 50 years, although Tamer just gave us some new numbers that are even more stark and concerning. So simply put, the climate crisis is a health crisis, but it is also an economic and security crisis. It is a moral crisis. It is a fundamental crisis for our survival. And so if it is unchecked, everything we know goes undone. But there is hope, because we are finally seeing the recognition of these impacts. And we know that COP28, which has been mentioned a few times now, was historic in terms of its focus on health and starting to make a transition away from fossil fuels. Fossil fuels finally made the formal text as being a cause of some of the changes we're seeing. Within health, we saw over 150 countries sign on to the Ministerial Declaration for Climate and Health. That went from like 20 or 3 in past years to 150 being represented. And over $1 billion was pledged in financing for climate and health, $775 million for neglected tropical diseases, and a fund of $30 billion announced to begin to accelerate our adaptation to climate change and health and to roll in more funding. But the problem is, and it did not go far enough, which is not meant to be pessimistic. It's meant to be about the opportunity and the challenge ahead for all of us that we get to rise to in this moment. Because from this COP, we actually still have to chart out that path to a just phase out, a rapid but just phase out of fossil fuels to ensure a just and fair transition to a greener and healthier sources of energy. We must urgently mobilize much more funding, both to adapt and build the resilience against climate change and to meet the UN's estimated financing gap of $366 billion a year for countries' adaptation plans. And the evidence is clear. The panel shared this, and many people have too. The cost of inaction is not one that we can bear. And even if all fossil fuel use stopped today, right, the impacts are going to compound. We're going to continue to see these changes even if we stopped everything here and now today. I want to share, and I'm grateful very much for Naveen for your calling out the work of SEED, because SEED, we are trying to have this impact on a policy and an advocacy standpoint, but we're also implementing in those communities, in these countries, on the ground every day, which is where actually we can inform the work that we are doing in some of these larger global conversations. And we're seeing the impact on climate change in the countries that we work in Malawi, Uganda, Sierra Leone, and Zambia. And so part of our response has been to think about rapidly building assessment tools for how climate change is impacting health and health systems and health workforce, such that we can quickly and rapidly pivot to respond. Because it turns out that storms and flooding are absolutely destroying the health infrastructure in these countries. Drought has been putting millions of children at risk in the places that we are working. In fact, there's now a national emergency in Zambia because of the drought that's happening. That's on top of the cholera outbreak they have just endured, and on top of the debt crisis they are facing. And these outbreaks from diseases end up drawing resources and funding away from the essential health services, such as antenatal care, routine immunizations, and preventative care. So when we see a shock and we revert and we pivot to that shock, we are undermining all the progress we've been trying to make and carry forward on the essential services that we are doing. Over 90% of countries saw disruption of services in COVID. A country like Zambia and Malawi, when they face cholera, has to drop everything to save lives urgently. Taking Malawi, a country where we've worked now for well over a decade, the government spends $34 per capita on its health. So we do need to talk about mobilizing domestic investment and having countries lead. But if there just isn't the fiscal space, and health is already the third leading cause, or the third, not leading cause, it is the top 3 highest funded sectors in the country, health. The government is trying to put its money to health. But when you have only $34 per capita to spend on health, yet you need 76 to provide a basic package of services, and then you have a storm come that washes your bridges away so you can no longer access the health center, or you have a cholera outbreak that infects tens of thousands and kills thousands and shuts down your schools. It's very difficult to move forward. And the reality is that in the wake of devastating storms in the last 2 years caused by climate change, when health facilities were washed out and the country saw the worst outbreak of cholera, as I mentioned, all of their essential health systems are getting compromised. So those $34 don't even go as far as they need to in the first place. And when you get these climate-related shocks, it compounds the picture, derailing resources, and what it ultimately does is puts a country like Malawi, communities, into this vicious cycle of poverty and poor health and undermined economic growth and human security. When and how does that cycle stop? We are in 2024. And so that does force us to think about how we're going to answer that most pressing question. And so the good news is we do know the solutions. They're actually quite straightforward. It is a question of partnership, it is a question of political will, and it is a question of thinking about maybe how we kind of flip the equation of how we do things. First of all, we do need to phase out greenhouse gases. and emissions and fossil fuels and ensure just transition so that lives and livelihoods can be protected everywhere. And we need to be thoughtful about which countries are the offenders and need to go most quickly, which countries need support and can be building towards a green energy transition. And we can't accomplish our goals without mitigation, so we do need to pay attention to mitigation. But we must prioritize strengthening health systems so that we can adapt and build the resilience we need to climate change. Because investing in health systems can be one solution to many challenges. Rather than funding diseases, funding pandemics, funding climate change and health, if we flip the equation and we fund strong, resilient health systems founded on a strong health workforce, able to adapt to shock, to provide primary care, to deal with mental health, that is your climate and health resistance. That is your pandemic preparedness. That is your maternal care. Thank you. Someone agrees. I love it. But it is our ability for early surveillance and responsiveness to pandemics, and it's our ability to meet the rising burdens of disease for climate change, and it is our ability to finally end HIV, to keep children from dying from malaria. It's the ability to take care of all of our diseases and finally invest in primary care and the universal health coverage we seek. And it is the health, and I want to highlight too the importance of this because people always get, I think, overwhelmed by how do you build an entire health system? It's very simple. And yes, I'm biased because I run SEED. You train health workers because it turns out health workers are the ones who are your early surveillance system. They are the ones who will hang a bag of blood when a woman is hemorrhaging in childbirth. And they are the ones who can triage for you, not only what's happening with the patient in front of them, but they will triage the best buys of a health system to save the most lives. And when you've done that investment, they'll triage the next one for you. And so it starts with our health workers. And finally, to talk about the elephant in the room for all of us, we have to unlock and mobilize legitimate financing now to build resilience and adaptation against climate change. And it does mean large-scale financing to make the investments to strengthen health systems and build the health workforce. But mobilizing available funding goes beyond only galvanizing additional monies. It requires an examination of our entire financing systems and structures, as well as our priorities. Because all funding, yes, must be flexible, longer term, with its focus behind country priorities, and it must be aligned behind single country plans rather than focused on donor metrics. Minister of Health of Malawi, the Honorable Minister Chipanda, will be the first to tell you why can't funders just fund my one health plan with my one vision, with one set of metrics and one set of reporting, so I don't have to waste my time running in 50 directions, 50 plans, and siloing how the funding goes. We've been so piecemeal as a global community in investments in global health and siloed even within our own field of health and speaking to the converted. We haven't built the resilience needed or meaningfully confronted the status quo of systems that impact our health and well-being. And so as a result, we are actually starting to backslide on progress now. We are losing ground on the Sustainable Development Goals after over 30 years of trying to invest in them. So we need to think differently and boldly, at scale and across sectors. And so I want to thank the World Bank for starting to really push the thinking and for the Ajay Banga for starting to, shift this in the private sector and having, the foundations and the US government. All of us need to be breaking across our silos now. And I think a very powerful example of this, for example, is the debt crisis, which is crippling many countries around the world, like a Malawi, like a Zambia. It's worth noting that Africa spends more on debt service costs than it does on healthcare. So when we talk about transformation and busting systems, it has to start with how the systems across these sectors are set up. Because we have to create the fiscal space needed for governments and funders to make the necessary investments in health system strengthening. We have to help Malawi get at least to its $76 and well beyond to meet this moment. And we must do things differently because if we fail to act, our path will not be able to meet this moment that we are in. So we have to use every lever we have to be transformational, to create the strong, responsive health systems we need, the health workforce that is foundational to it for today. We have to lay the foundations for well-being and speak not just in terms of degrees Celsius averted, but in actual lives saved. We have nothing but infinite possibility in front of us, but it is going to take our collective commitment to make new, bold investments, to give up a little of what we often hold on to and the practices we know and are comfortable with. And it's going to take us working together in unprecedented ways to meet the challenge of climate change. I often and will always say, there is no such thing as too ambitious for this moment. We can address the burdens of disease that we face from climate change. We can start to think about how we close the equity gaps in this world today. We can think about how we fundamentally transform our systems and our way of doing business so that we are doing well, we are doing good, and we are starting to really understand the primacy of health for our fundamental well-being, our security, our economic growth, for all the things that we seem to value, but most importantly, for just our fundamental humanity. So thank you very much for letting me join you today.
Thank you for that very inspiring speech.